Some call them pressure ulcers or pressure injuries. Some call them bed sores. Whatever the name, everyone in healthcare can agree they are a cause of needless pain and suffering for millions of patients, and a cause of higher costs for patient care. The key to preventing pressure ulcers is a treatment plan that includes dressings specifically engineered to protect against all four of the external factors that cause pressure ulcers: pressure, friction, shear, and microclimate. Malnika's Mepilex border dressings are unique in this regard, thanks to their deep defense technology. Mepilex border dressings are the only dressings with this deep defense advantage. But what does deep defense technology actually do? Deep defense is the term we use to describe what happens in clinical use when the 5 layers of Mepilex border dressings work together as a system. Together, they provide an optimal balance of strength and flexibility. While each layer contributes specific properties, they were designed to work together to protect against all four of the external factors that cause pressure ulcers. Let's begin with the skin contact layer, which uses Malnika's well-known and trusted SafeTac silicone material. SafeTac reduces friction between the skin and dressing due to its strong yet gentle adherence. This unique adherent property enables the dressing to be moved and repositioned on the skin for skin assessments. There are 3 absorbent layers in the middle of the dressing which are optimized to absorb and retain moisture. These layers don't become overly bulky when wet like some other dressings. This is important because excessive bulkiness can actually contribute to higher pressure, as well as cause the dressings to become detached from the skin due to the bulk. Mepilex border dressings are specially engineered to maximize absorption and minimize bulk, while also maintaining their strength even after moisture is absorbed. Additionally, the combination of these layers provides a cushioning effect to help absorb and distribute out pressure and shear. But there is something else about these middle layers that is key to why the use of our deep defense technology is so effective at protecting against pressure ulcers. These layers are strong in the direction patients normally slide and absorb some of the shear forces that could contribute to deep tissue deformations when the patient is sliding down in bed. But the dressing is also flexible in the side-to-side direction to allow tissues on the sides to gently adapt to patient shifting and movement. There's a scientific name for this quality: anisotropy. Anisotropic dressings have been shown to provide more soft tissue protection than dressings that are stretchy in both directions or those that are stiff in both directions. No other pressure ulcer prevention dressing is anisotropic. Importantly, this anisotropic strength is also not degraded when the dressing gets moist with the absorption of sweat. Deep defense technology provides you with this important anisotropic quality. The 5th and final layer is the outer layer, which touches the bed sheets or other support surface. This outer layer is breathable and allows moisture to evaporate to help manage microclimate. The fact that it is very smooth helps protect against shear by ensuring that friction doesn't hold the skin in place, while underlying soft tissues stretch and deform. Together, these 5 layers of deep defense technology work to address the 4 external factors that cause pressure ulcers. No other dressing has these unique and proprietary features, or the same level of scientifically and clinically proven effectiveness, reducing pressure ulcer incidence by up to 88%. And that's a relief not only to your bottom line, but to the millions of patients who suffer from bed sores every year. Don't just take our word for it. See the proof for yourself.